Welcome everyone. This is our second official chat with a Changemaker. As you all may realize, we've had a name change from our Black Alumni Connection series. We wanted to be able to reach out and have a little bit more diversity with some of our other change makers that have come through the College of Public Health. And so this is our second official with the rename of Chat with the Changemaker. So I'm Kim Metcalf. I'm the Vice President of our College of Public Health Alumni Board. And I'll let Erica give us a little history on the board when she introduces herself. But that is who I am. I'm going to be hosting tonight to work with Chris. But look, I've got a list of prepared questions and I'm going to do his intro that he officially sent me. And I have a feeling that after y'all hear that intro, I'm not going to need this list of canned questions that I've got, because you're going to be so excited. Because as many of you may or may not know, I'm an environmental health science major under the College of Public Health. Chris's career is truly an intersection, I think, of public health and environmental health. And the things that he is doing in his career right now are really impactful, especially with the work he's doing with children. And also, I hope we get a chance for you, Chris, to tell us about where you're living now and how that whole thing came about. Because that is such a cool thing as well. So Chris has got amazing stuff to share. So that's me. I'm going to quickly let our board of directors just introduce themselves really quickly, so that anyone who's on here who doesn't know who's on the board, you will know, and then you can reach out and connect with us and make sure you're plugging into all of our events. So I'll kick it to Erica next.
Good evening, everyone. It is so great to see you all here. Thank you for joining us this evening. I am the Alumni Board President, and we just turned 2 this year. And this actual chat with a Changemaker will be 2 in April of next year. We launched April 2021. The year of April 2021. I said too fast. April 2021 during National Public Health Week. That's what I was trying to get out. And so we have come a long way. We've had a lot of you on here, I know we probably had about 20 by now that we have interviewed. We've had some great conversations. And so we're so happy that you're here. This is interactive. Please put your questions in the chat box. I'll be monitoring the chat box tonight, and I'm gonna kick it to someone else. David.
I am David Johnson. I am just recently joined the board, and recently graduated the University of Georgia in 1993, and spent 27 years in Oregon in occupational health and safety, working for Oregon's largest workers' compensation insurance company. So help a team prevent occupational diseases there, and I'm happy to be here and hear Chris. So thank you for being with us.
Thank you.
And I'll kick it over to LaTanya.
Good evening, everybody. I'm LaTanya McGinnis, class of 99. I am currently an assistant vice president at Icahn, where I do corporate well-being consulting. And excited to hear from you, Chris. So thank you for joining us today.
Thank you. Thank you.
And Meredith, I'll kick it to you. You might be on mute, Meredith.
I am. Thank you, guys. Thanks for being here. Yeah, this is Meredith Woodman. I graduated in '96, and I'm the executive secretary for the board. We're really excited to have you tonight, and thanks for joining us. All right, so who else do we have on? Let's see here. All right, I'm going to send it over to Fabrice.
Hi, thanks so much for being here, Chris. My name is Fabrice Julian. I'm class of 2013. I'm currently an assistant professor of health and wellness at the University of North Carolina, Asheville, and really looking forward to hearing your talk tonight and to learning a lot about what it is that you're doing and what you've done. I'll turn things over to Nichole.
Nichole,
I'm here. Sorry, my finger wasn't working. Let's see, where's my video? I'm all late and stuff. There we go. I'm in a bad spot. I got too much light. Sorry, y'all. Hello. Sorry, I was trying to do that virtual background like Kim. It wasn't working out for me. Hi, Chris.
Hi.
Good to see you. My name is Nichole Hancock. I've just joined the board this fall and having a great time. I graduated in '94 with a health promotion and behavior degree. Worked about 20 years in public health with Emory, and then went on to Emory and then Maximus, a healthcare consulting company. I'm doing some innovative stuff. Currently, I'm a home baker, but I live and breathe still public health. So I'm looking forward to hearing what you've been up to.
Oh, thank you.
You're welcome.
All right. I don't think I missed any board people, and we're still adding folks in, so that's good. So I'll go ahead and read Chris's
Can I
official
go?
bio.
Oh, we got Lori.
Hi, Lori. Yes, go please.
Sure. Hi, Lori Elmore. I am class of 2000. I have been on the board since a year before its inception. So I guess officially 3 years. So I work at the Centers for Disease Control and Prevention, have for the past 18 years. And my current position is in the Office of Appropriations. Look forward to being part of the discussion today and hearing more about your work, Chris.
Thank you.
All right. Did I miss anybody else? All right. So I'm going to read Chris's official bio. Chris is MPH 2018, so he's one of the younger folks that we've had participate in this. So we're excited to hear where you've been just on the few years since we've been missing you in Athens. He also has a certificate of global health from the University of Georgia. He's the senior program coordinator and certified asthma educator at the Icahn School of Medicine at Mount Sinai Hospital in New York City. More specifically, he coordinates the Region 2 Pediatric Environmental Health Specialty Unit, a US EPA and CDC government partnership, providing environmental health services to communities in New Jersey, New York, Puerto Rico, and the US Virgin Islands. He also serves as the clinical and finance coordinator for the New York State DOH-funded New York Children's Environmental Health Centers. It's the first statewide publicly funded model for children's environmental health clinical services in the U.S. Its NYS check sites are located across New York State, with Mount Sinai serving as the coordinating center. Christopher's primary day-to-day role is coordinating the center's telehealth medicine program for pediatric asthma patients. He counsels caregivers on children with asthma, how to manage their asthma, and then reduce their environmental triggers and minimizing the environmental impacts on them. His expertise lies in program evaluation, stat analysis, indoor air quality, built environment, and epidemiology research methods. As I mentioned, he is a UGA graduate, but he earned his bachelor's in biology from the state of University of New York in Geneseo. Am I saying that right, Chris?
At Geneseo.
All right.
Geneseo.
Perfect. And he is a fellow member of the Delta Omega Public Health Honor Society. So that is Chris's official bio. And like I said, I love that you have the intersection of environmental factors and how those are influencing the public health issues, specifically of children that are dealing with asthma. As the mother of 2 children with asthma, I totally appreciate what you're doing in this arena, because it's a scary thing to deal with. But to get us going, Chris, do you want to say anything before we get started, and then I'll hit you with that first question?
No, I think that first question kind of leads right into it. So let's get started.
Perfect.
Yeah.
Perfect. My first question is, how did you become interested in public health? And then the second part of that is, how did you end up at the University of Georgia from New York?
Yeah. So I always think of it as like a natural progression. I was always really interested in the sciences growing up. I was really interested in sciences in middle schools. I was winning a ton of science fairs, and I went on to college and became a biology major. And I knew that I really wanted to stick to hard sciences in some sort of way. I knew I didn't want to go to the medical route, but I knew I wanted to stick to hard sciences. I know I wanted to stick to kind of the technical sciences, but I really didn't want to have that rigid kind of background where I was just a biology major or just a biochem major. I really wanted to have some nuance, and I really felt that public health really gave me that nuance. And that was really interesting to me, because science is always A plus B equals C, but public health is A plus B maybe times D, C3. There's many confounders, right? There's many other situations and underlying things that really contribute to health and outcomes. And so that was really kind of a selling point for me to public health. And then essentially how I got to Georgia was that my mom had relocated for her job years prior. And I knew I really liked the Atlanta area. I knew what the CDC was about. I really knew that that was kind of a big epicenter for health. And I really wanted to go to one of the best places in Georgia for school. And so that's how I ended up at UGA. And it's been a blast ever since, one of the greatest decisions I've ever made. And I really just feel thankful for the faculty and staff that I got a chance to meet and work with at UGA. It was really world-class experience for me. And so, yeah, that's kind of, I feel like it was a natural progression, honestly.
Awesome. Walk us through how you left the University of Georgia and then kind of how your career has progressed over the years.
Yeah. So I should say, actually, let me start how I actually kind of what I was doing at UGA. I felt like that I knew I was there for 2 years, so I knew I wanted to get as much impact as out of it. So I was doing a lot. I was basically being a graduate assistant. I did research with HIV with Dr. Sikandi, Public Health Association. I was the president of Public Health Association. So I really wanted to get my hands into a lot of things to really understand what I liked and what I didn't like, and what I was really kind of good at and what I could improve on. And so I originally thought that I really just wanted to go specifically in infectious diseases, sciences, and epidemiology. And that was kind of what I was dead set on. And I really wanted to work specifically with HIV. I knew that the CDC was close by, and I knew that, Atlanta and Georgia specifically had really good kind of networks and public health related to the HIV kind of prevention network. And so that's how I kind of started off. I was doing a lot of conferences and working with a lot of people, the Department of Public Health, in order to kind of really spread my wings in that field. And so I honestly, as I was leaving University of Georgia, I got this opportunity to go to New York through a colleague of mine who also went to University of Georgia, graduated my year. His name is Toby. And he had completed a kind of a grant, kind of a trainee grant at the current department that I am now. And even though it was 3 months, he was like, well, you know what? I think you'll be really good at this. I think that they're looking for a person just like you. I think you'd be a really good fit. And so I wound up applying and I wound up getting accepted into this grant working program, which was to encourage recent graduates in order to broaden their research scope. And so I was originally dead set on being an ID scientist, but the grant was in order to broaden research and to work into environmental health and environmental medicine. And so I got a chance to go to New York City after graduation. And in my head, I'm thinking, I'm going to come back to Georgia. I'm going to come, my family's here, right? My network is here. And I was like, I'm going to come back. It's only 3 months, and it'll be really, really cool. Well, 3 months turned to 6 months. They doubled it. And then 6 months turned into 4 years later, as I am now. So needless to say, it really was a good fit. And it really was a good opportunity for me. And so essentially, that's kind of my path to getting to New York. Yeah.
All right. So to kind of do a timeout and kind of do the career path, tell everybody about where you are now and how that happened, because I think this is fascinating. The personal path that you have followed on where you're living now. Can you clue us in on that?
Yes. And so I ironically live in Tulsa, Oklahoma, even though I still work remotely from New York. And I got to Tulsa, Oklahoma because when I was living in New York, this was kind of during the height of the pandemic. And I was really just fooling around on the internet. I remember it was, very vividly. It was 3 a.m. in the morning, and I was sitting in my Harlem apartment, and it was very kind of a moody night. And I looked up. I was just messing around on the internet, and one of the articles was 10 extra ways to make money during the pandemic. And I wasn't, I'm a person that's like, okay, I like to get into everything. Like, what can it show me, right? And so one of the things on the list was called Tulsa Remote. Now, Tulsa Remote is a program that brings remote workers from all over the country, all over the world, to live in Tulsa, Oklahoma for 1 year, in hopes that we stay and provide economic stability, economic growth, social and cultural growth. And the idea was that if you stay for 1 year, you get we'll give you $10,000 cash, no questions asked. All you have to do is live here for 1 year. And so I said, oh, okay, this sounds like it's a load of, whatever. So I applied because I was thinking this is a pipe dream. No one just gives out like $10,000 just to live in a place for 1 year. So I said, you know what? It's a win-win situation. If I do win this very weird kind of situation, then I get to go to Tulsa, Oklahoma for 1 year and I get $10,000. And if I don't, I get to stay in New York. So it really was a win-win situation for me. Well, needless to say, it wasn't a scam. It wasn't fake. 3 days later, I got an email back from the runners of the organization, and this organization is actually funded by a very big billionaire here in Oklahoma called George Kaiser. I know that you guys are familiar with George Kaiser. He owns half of the Bank of Oklahoma, a very big philanthropist. And so he basically funded this program and a lot of other programs in Tulsa in order to build the economic ability and capacity here. And so needless to say, 3 days later, I was a semifinalist. The week after that, I did my video interview. And then 3 months later, I was living in Tulsa, Oklahoma. And that has been since 2 years ago. So needless to say, I do like it. I am very much enjoying my time here, but very much a contrast from both New York and Atlanta and Athens. But I always say that Athens reminds me a lot of Tulsa in the way that it's very kind of small, very community driven, lot of very big cultural as far as, microcosm as far as art. As far as music, as far as like food, same with Athens. So I really felt comfortable coming here because Athens, that was one thing I really enjoyed my time at Athens was the kind of the cultural aspects of it, the night, going to the live music scene, going to the really good restaurants, the good arts that they had there. And so it was really, it's a place where a lot of innovation is encouraged, and that innovation spirit is really kind of pervasive throughout the community. And you can see it's a very visceral spiritual energy here, the thing that I found in Athens. A lot of good, spirited people, very kind people. So I felt very comfortable moving here, and it's been really, ironically, a lot of people say, there's no tumbleweeds there, and I'm like, no, there's no tumbleweeds here. I live in an apartment building, and it's a kind of city-like, but very, very much slower, of course, but you still have those things that I mentioned prior.
That's awesome. So if you stayed 2 years, do you see yourself staying there a little bit longer?
I do see myself staying here just a little bit longer. I do miss the East Coast a lot. I miss the East Coast. Again, yeah, Nichole, I see that a lot of such rich history in Tulsa, especially when it comes to just Black individuals, Black wealth, Black kind of businesses. I'm not sure if you guys are familiar with the Tulsa race massacre that happened here in 1921, but that is something that that they are trying to, and they are actively, building back. And there's a lot of energy and a lot of, influx of money and resources going to that area and to the people that live here. In order to make it, I always say they try to make it the next Austin, but I really think they're trying to make it better than Austin, right? Really a city where it is diverse and just full of rich history and rich future, actually. Yeah.
That's awesome. Any questions on anything so far for Chris?
None thus far.
All right, that's awesome. Kind of remind me of David. David went to the Pacific Northwest and never stayed for 27 years. So you never know when you leave Athens how long it's going to be before you get back.
Yeah.
All right. So to get us back on track with your career, what do you think at UGA prepared you to be able to move forward in this public health arena? And also, just to be frank, anything that we as the board of directors can help the college to improve on. Is there an area that you felt like, oh, I really wish we'd done a little bit more of this? So what kind of feedback do you have there?
I would say that the things, what I found really useful was, again, like kind of the classes and also the professors and also the lessons. Like I still have all my folders with every single lesson I've ever taken, every single project I've ever taken. And that is something that I actually look back at often, right? In order to be like, okay, I don't remember that thing about this disease or this particular kind of epidemiological method. Can I go refer back to my class notes? I refer back to my class projects. And that really has informed me a lot through my career. Has really provided a great template for the work that I do now. And so just having that, continuously having this really, really good teachers, really good professors that really care about, their students, and that really want to, able to see their students, improve and also walk them through that door of opportunity. I really thought that the volunteer opportunities at Athens was really, really helpful for me. I always say, to students, current students, take some time to do something good for someone else while you're there. I know you're studying and doing a lot of work, but I remember two main things that stick out to me was the mapathon, where we were able to map out, I guess, certain things on Google Maps, certain areas that, in case in the future, in case of an emergency, those who are able to aid, those type of areas would have a visible kind of accurate map. And the second thing was by Dr. Grace Bagwell Adams, the Athens Wellbeing Project. And I'm not sure if that's something that's still kind of being done, but that project specifically put a lot of perspective for me as far as understanding what it looks like outside of the bubble, right? Outside of that ivory tower. I think that us as, public health professionals, and in those, we're either like, in offices or the buildings or behind computers, right? But we don't necessarily, a lot of times, might get out to the community. We might not understand what the community needs, or understanding what the community looks like. And I think that that specific project put a lot of perspective into me, where I was going to this really big world-class institution, but really the surrounding parts of Athens were very maybe impoverished, right? Or, people who lived in those types of communities didn't have access to a lot of the things that we had access to just by simply going to school. And we were in the same area, right? And so, one of the things that sticks out to me the most is, I was interviewing, because part of the Athens Wellbeing Project was interviewing door to door different communities about what they wanted in their own communities. And we would say things like, okay, where do you bank at, and where do you deposit your checks? And the interesting thing was that, a lot of people, many people, more than I expected, they were older people, never had bank accounts in their entire life. And when you stop to think about how important a bank account is in order for economic mobility and upward mobility, you can, of course, understand the reason, the situations why people were in. And so that really put a lot of perspective into me, where, a privilege of access, and how do we get people who need it the most, who need help the most, to get to be visible, to be at the stakeholders table. And then third, I think that the internship experience really set me up really nicely for real world practice, real world experience. I always, if I was to give any suggestion to any students that may be watching or will watch this, is that, you should be using all the tools and techniques that you learned in class at your internship. And so what I did was, not only did I technically did 2 capstones. I did the one for actual school, and I did an entirely separate manuscript paper for where I was interning at, which was the Department of Public Health in Atlanta. And that was some information that they used, and it was actually really, really helpful to them. I did a project on the correlations between mental health and injection drug users. And we were on a cycle where we were interviewing injection drug users and just really trying to understand kind of behavioral and risk. And so used every single tool that I learned from the, EPI 1, EPI 2 biostats to really just, help a situation or organization that didn't have that capacity at that time. So also, I think that the internship helped me a lot with the job hunt. I always talk about, connections, and that's a connection that that was lifelong, that I've always had, that I've maintained. And so I would say, sort of those 3 things is really what helped me and really prepared me a lot for the real world, which is, again, just really world-class classes and professors, internship opportunities to get a better nuanced view of the world, and also just really good internships at top agencies in order to really get a leg up on the competition. I think we're all colleagues, but essentially, yes.
That's awesome. Can you tell us, because I know we got a question that popped up in the chat box, but before we get to that question, talk to everybody, explain to them how you have that intersection of public health with the environmental issues that the children you work with on a daily basis are facing, and kind of explain that process to them, because I really do love that you truly, because I feel like I'm environmental health science as well, but I am truly more in the environmental side of it. And so I love how you have totally combined all that this College of Public Health has to offer in your career.
Yes, absolutely. So my first project when I went to the Mount Sinai was actually a research study. So now I work on the clinical side, but my first kind of job was on the research side where I was going around, we called it the Stove Project, which was studying the optimal ventilation in the environment. And so we essentially went to different, apartment dwellings throughout New York City, and our control was those that essentially didn't have great ventilation, and the experimental version was those who did have, higher ventilation, more advanced ventilation. We call it ASHRAE compliant ventilation. And so I would go around these different dwellings in New York City, which was also the very field-like public health thing, interviewing families, setting up their environmental equipment, testing the air quality, taking that data back, analyzing that, and then cross-comparing that with the results, the survey results that we found. And we found, which is very, I would say what makes sense is that those who had better ventilation obviously had lower amounts of things in their, lower amount of toxins in their air. They felt better, they were healthier, right? And so that made sense. And so once that project was completed, I moved on to the clinical side, and I was working specifically with children. And now we work at the Children's Environmental Health Center, where we take on a whole bunch of cases throughout the tri-state area. So those cases range from lead exposure, mold exposure, PFAS exposure, ethylene oxide exposure. We just had the new ethylene oxide kind of briefing, and we get calls from parents, health professionals of essentially what to do, what to say, what should we, guidance in those. In that aspect. And so where I come in for the asthma portion is that I, manage a telehealth program. And that has been something that we've built from the ground up to say, okay, we have this population that that we know that needs help. We know that specific demographics in different areas in New York City, such as the Bronx and East Harlem, have really high rates of asthma. How do we fix this? Like, how can we bring an environmental component to it? And of course, a lot of people might not know is that asthma has a huge environmental component to it. Even I was ignorant going into, when I was first learning and kind of exploring that field, I always thought that, well, asthma is really not that, prevalent, or it's really not that big of a deal. And then you learn that it's actually that big of a deal, and kids actually still die, and get admitted to the hospital every single day for just asthma. And so we built the telehealth program, basically from the ground up, from the survey questions that we asked, the database, to the insurance companies and the payers that actually subsidize the consultations. And in order to kind of aid and support the clinicians that were doing the actual consultations, I was advised to get my AEC, which is a certified asthma educator, which is this pretty, substantial kind of questionnaire, kind of credential, where I was able to where I'm now able to provide counseling, guidance, treatment management to those who have asthma. And so the environmental component about it is that we actually use our community partners, and we actually contract out community partners in the actual local community to actually fix any environmental issues that might be causing triggers for the child. So if there was, mold inside the home, if there was roaches inside the home, if there was dust mites inside the home, anything that might be allergens or common household triggers, we would first educate, then we use community partners in order to get those repairs fixed. And so there's a two-pronged kind of system we're using. One is the education, where we're telling people, here's things how you mitigate asthma, here's things that you should avoid. And on the other hand is that environmental component where we're fixing, any allergens that they might, any sources of allergens. And so we all know that roaches and mice and mold and dust mites are one of the biggest, if not the biggest, allergens that contribute to asthma exacerbations. And so that's the environmental component that we kind of work with. And we're one of the first kind of statewide model and one of the largest teams across the country that deal specifically with children's environmental health in that way. So yeah.
That's amazing. And again, it just hits home for me because as the mom of 2 girls with asthma, and I have asthma myself that was not diagnosed until I had COVID twice. You know, seeing how you are truly having an impact on these kids' lives, because I've seen that with my children when we got better ventilation in our house and got rid of carpets and things like that. It improved their health. So, all right. So Erica, I know we had some stuff going on in the chat box. You want to catch us up?
Yes, we do. I want to make a comment. I love this piece on the asthma part. You brought me back to when I was contracting at Fort Jackson. That was one of the issues that we had a lot with the military, children on the base. So the education piece is so important because it helps us to feel empowered in the things that we can do. A lot of folks don't know there are things in their home that triggers all of this. But we have 2 questions for you. So the first one is, any regrets about not getting your DRPH or PhD?
No regrets, because I think that's still in the pipeline. So it's the funniest thing. I sent my dad and I said, hey, I'm gonna talk to UJ, because he always texts me. He's like, UJ is playing, okay, go Dogs. And I'm like, hey dad, I'm giving it, talk back to UJ today. And he was like, good job, I'm proud of you, son. The PhD is next. So I set pressure from all over sides and pressure on myself. So no regrets yet. And I'm just taking my, but I do think that's in the pipeline. But I'm just also having a lot of fun. I'm also just having being comfortable. I think a lot of times we get caught up in like what's next and what's further and how do we get to this part or whatever like that. And understanding that I'm exactly where I've always wanted to be. And I'm really, really, really excited and proud of myself for just being where exactly, because I didn't think that I would even be in this type of situation. Didn't think that I would be as far as I am so early on in my career. And I think that I'm just scratching the surface already. So I could only imagine when I get a DRPH or a PhD where I would be, or what I will and what I can do. So still in the pipeline. So no regrets yet.
It's safe to say that is in the process. And I do believe when you do get there in due time, you will have a lot to bring to the classroom, a lot of practical experience. And that is the most important thing.
Thank you.
The next question that we have for you is, can you describe some of the challenges you see with regards to impacting the incidence of childhood asthma in New York?
Yes, absolutely. So one, it's very difficult because there is, there's a lot of nuances of those who even live in New York, particularly just inherently. So New York is very densely populated. It's very kind of segregated as far as the wealthy and the poor, right? And also the access and all the resources that they get provided to them just by being in zip codes, right? And we know that in New York, if you don't know that, literally, poverty versus wealthy literally is block by block, right? You could be like on one side of the town and where it's very, very wealthy, and literally just maybe a couple steps away, you have multi-million, billion-dollar kind of establishments and homes. And so one, there's a huge wealth disparity there. 2, because a lot of people are densely, because it is densely populated, a lot of people live with each other and live on top of each other. It's very difficult in order to do any asthma remediation without it causing too much of a big stir. So say, for instance, you have these New York City style tenement buildings where they're very old pre-war buildings where they can't be modified that much because they're historical artifacts themselves. And to retrofit any of these buildings with like a new ventilation system is astronomical, right? In cost and capacity. And also there's a large, portion of New York City public housing. And so that's an entirely different kind of ball game itself, where the managers of that might not necessarily want you to actually be inside the dwelling. They don't want you to probably do any testing inside the dwelling. They don't want you to remediate in the dwelling because it can potentially get them in trouble, right? And so they move kind of slow on the dial with change there. But also, like I said, it's really difficult to do any type of ventilation, remediation. And basically, a lot of things that we can do is just trigger avoidance, maybe to really fix things that's already existing, maybe any holes or cracks or drafts that need to be, fixed, that we can do that. But I would say that just inherently, just the the way how people live, and because it's so expensive. It's extremely expensive to move around the city if you don't have if you don't have the ability to move around, right? You might have a car, but it's might be expensive to park anywhere. It might take you a long way to go anywhere on the subway. And also just generally living expensive is astronomical. Health expenses is more expensive there than pretty much anywhere else in the country. So even going to the doctor presents a challenge, right? And multiple people have multiple different children. So a lot of women that I work with have multiple children that also have multiple ailments. They might have ailments themselves. They might be single moms. And it's hard to literally carry anything, right? You can't even go food shopping there without having to carry it, several blocks, several, steps of stairs, on trains, subways. So even the fact of food shopping, going grocery shopping, it's really difficult for people. So compound that with multiple children that might have multiple doctor appointments with multiple ailments, and right, you also have to work because it's super expensive, childcare, right? So that's where this kind of the social aspect comes in, the nuance comes in, because it's really asthma is really manageable if you have all the resources and all the help that you can get, right? If you don't have, if you're worried about food in the home, of course you're not going to, pick up a child's medicine that might be expensive, or you might try to wean it out or try to stretch medicine. There's certain, compromises and cuts that you do living there. And so I think it's that back and forth of essentially where they are, and sometimes parents can't help where they are. So yeah, it's really difficult.
Chris, do you see, since you've got this program up and running in New York, being able to take it to other cities like Chicago or Atlanta or places like that? Because I would think we need that in other cities as well.
Absolutely, and I think that what's in our ideas right now is to really fine tune our program so we can be a model for different cities and larger cities that have kind of the same sort of situations. So absolutely, I think that this program, it's absolutely able to do that. I think it just takes time and funding. I think a lot of places might be under-resourced and underfunded, and it takes a significant amount of time. And this is state funded. Yeah, exactly. If the state funds it, and whether it's built into our New York's legislation, actually, in order to fund the New York State Children's Environmental Health Centers, and our budget actually has just doubled from.
Oh, wow.
Yeah. It's just actually doubled. So there was a 5-year kind of pilot, I would say, but it was a 5-year kind of deal where we just extended for another 5 years, and that budget has doubled to really expand the capacity. So that means more scholars, that means more doctors, that means more, certified asthma educators. That means a lot more to really help, the community. But yeah, absolutely, I definitely can think it can be expanded.
Chris, it's Stuart Feldman. How are you?
Doing well.
I got 3 things. One is, I guess the more important one is the families you work with. What's their access to technology that they need to be able to do the telehealth counseling?
Mm-hmm. Just a phone, just a cell phone. We actually have two methods that we use, is either by video or just strictly by audio. And so we send them a link by text message. They're able to just click open the link and participate in a telehealth visit that way. Great.
The second question is, where in New York are you from?
So I went to school upstate New York. I went by Schenectady, New York. I'm originally from Schenectady, New York, and I went to Geneseo, New York, First State University of New York at Geneseo. And when I lived in New York City, I lived actually in Manhattan. I lived in Harlem and Greenwich Village. So the kind of the upper part of Manhattan, and then kind of the lower part of Manhattan.
Yeah, I know it well. I was up in New York for a while, starting the pharmacy school that's in Harlem. So I'm familiar with that, and Mount Sinai. The third was, I was kind of excited that when I would get to New York, I'd be able to visit with you, but I don't think I'm going to Tulsa. That's kind of it. Anyway, thanks.
Well, if I ever to make it back to New York in the next 1 or 2 years, I do think that I am going to be moving back to the East Coast. Please feel free to come visit and we'll have dinner.
That is awesome. So this kind of leads me into my next question. So Chris, what's your why? Why do you do this? Why? What is your calling?
Yeah, I think why, and I think I took some time to think about this, is that along with what I'm mostly proud of and most accomplishment that I'm most proud of is that I have the ability and I have the opportunity to wake up every single day and get to change people's lives for the better, very directly, without any research behind it, without any delay. I wake up and I'm able to change people's situations quite literally overnight. And so it's really, really fulfilling for me, honestly, to even speak with the patients and the mothers and things like that, to say, hey, I was really about to give up. And I was at my wit's end, and then I felt like you're an angel. You just called me out of the blue, and you've changed my entire situation. And I no longer, worry at night because I know my child is, is being well taken care of, and I know that we don't have to live with roaches or mice in the work. That's a hard mental distress to live with, to not even be comfortable in your own home. So I'm compounding that with everything else. You're not even comfortable in your own home. To know that they have someone to text or call at any time if they're having challenges. Because we work with our social determinants health screener, where we screen patients for their food insecurity, transportation insecurity, utility or medical access insecurity, and we link them to resources directly. Say, for instance, if they mentioned that they don't have enough food in their home, I'm automatically sending out a referral to New York Common Pantry, and we have a network with them where they're automatically reaching out back to the patient to close the feedback loop. And so being able to wake up every single day and get to change people's lives in the way that I do is one why I chose public health, but one why I love my job so much, and why I find it fulfilling is because I get to do that. And I think that is I think it's the best job in the world to be able to do that, to leave the world a little bit better than what you found it. So yeah.
That's awesome. So to kind of take that back to UGA, what do you feel like your legacy is at UGA? And just for the group to know, when Chris and I connected because we divided up, with our original board, our Black alumni, to reach out to them and just reconnect with them and bring them kind of back into the fold. And when I was looking through my list and saw his name, I knew his name because he was so involved as a student at the University of Georgia College of Public Health. And so I knew who he was, even though we had never crossed paths in any way. So I feel like you've left a big imprint on the University of Georgia with what you did there. But what do you feel like your legacy is here at UGA?
I feel like, so it's so funny. I just mentioned how I always think about leaving things in situation better than what I found it. And I think that's exactly what UGA did for me. I think that I became a better man, a better person, more kinder, more compassionate person after UGA. It's really opened my eyes up to just a myriad of different perspectives and circumstances and opportunity. And for what I believe is my legacy is to just be able to be bold. I think that I wasn't afraid to take the reins at UGA. I was really, really involved and active. Really wanted to be good at my craft, and I really wanted to be the best there is. I really wanted to do my best. And I think of like, how do you do anything is how you do everything. And if I can do really, really good job at being a graduate teaching assistant, if I can do a really good job at being the president of Public Health Association, if I could, really do a good job with research, that would help me in my career, but also, to bolster my reputation. I always think, and that's my advice to students, is that your reputation is pretty much everything, right? Your reputation will bring you into rooms and opportunities that you couldn't even imagine. And that's why I'm here. I think that's why you've heard me, because for the work that I've done, and hopefully continue to do. And so just being bold and just and having fun, like not being so stuffy and not being so, rigid with what you want to do with your time. I think that I would suggest that students, you're there for 2 years, have fun. UGA is a very fun place. I think that, sometimes you're on the graduate side and you're a little bit more sectioned away from the undergraduate side, and you might not get to experience that. But I was at the football games. I did all the, I did the bar crawls. Like it was a fun time. And I think that, you should, also engage in that, engage with the community, and really give back. I think that a lot of times you go into situations in schools and thinking about what you can get out of it, but like, what can you bring to the situation? What about your unique perspective and nuance that you can use to improve the people and situations that you're in contact with? So yeah, I think being bold is a great, hopefully, is a legacy that lasts. Yeah.
Okay, I always write down little nuggets of things people say, and it's hard to do when I'm also trying to be the host. So, but I just took the time. I love what you just said. How you do anything is how you do everything. I will be saying that to my kids as soon as we get off this call, because that is really important, because I think that's really setting the standard for yourself, but also for your colleagues and those around you, because I know that, eyes are always on us, and it's important to do that. What's your favorite UGA memory?
It was definitely, I would say the football games. I think that sticks out. I know it's a little cliche, but coming from SUNY Geneseo, was a very small school, and our biggest sport was ice hockey. And our amount of college students were about 5,000 compared to about, I think, around 40 or 50,000 for which is UGA. It was such a big contrast, but so much fun to see the culture of football there. So I really just enjoyed the games, the tailgating. It was a lot of fun. It really, really was a lot of fun and an interesting time. Also, I would say, I think that the student groups were really, really interesting. I remember going to a lot of kind of the student performances and groups, and just the UGA TEDx talks that they hosted there, just the different events they brought to UGA for the students. But definitely, I would say my favorite was the football game. Yeah.
That's awesome. Well, Erica, do we have any other questions, or anyone have any questions before I give my plug for how else we want Chris to be involved with the College of Public Health? Because we've got a couple of things we want to talk about.
No other questions. There's a lot of great inspiration here. You inspire us, and keep this up. Amazing work. Be bold, scream success. So no questions. There's a lot of comments. People are really excited about the work Chris is doing.